He's the owner of Vitality Chiropractic Center in Aurora, Illinois. Dr. Nottoli is an integrative diagnosis provider who specializes in functional anatomy, movement, and soft tissue diagnosis and treatment. Dr. Nottoli was a collegiate athlete in track and cross country, and he still competes in running events from 5Ks to marathons. He treats athletes from kids to the professional level and is the official chiropractor for the DuPage County Hounds. He also has worked as an adjunct professor of anatomy and physiology at the College of DuPage. So welcome, Dr. Paul.
Thank you, Kate. So welcome everybody to the webinar today. As I was preparing for this webinar and putting the final touches together, I came across this quote from Eric Cressy yesterday. Some of you that are personal trainers or athletic trainers probably know who Eric Cressy is. But he said, spending millions of dollars on facilities while not investing in a good sports medicine staff to oversee them is like polishing a turd. Pretty does not equate to development. This is all true at sports of all levels, from high school, college, pro, or private sector. So again, having your athletes healthy is extremely important, and it's very fitting that we're doing this webinar and that you're on here learning this information and trying to make your athletes the best as possible. Here's my contact information if you need to get a hold of me. So what will you learn in this webinar? You'll save time and energy by treating injuries quickly and effectively. You'll keep athletes training and competing. You'll prevent common sports injuries using the latest techniques and treatments. And you'll also recognize when the appropriate time to refer to the appropriate professional. So as we're working, Vladimir Janda said it best, and Vladimir Janda was a pioneer in rehabilitation and treatment. He first worked in his early years with post-polio patients, and he was one of the first providers to combine therapy and medicine in a hands-on approach. And he said, respecting the approach of motor learning, any dysfunction in the periphery should be normalized first. So basically what he was saying is unhealthy tissue must be corrected because it causes adaptations to the central nervous system, which creates improper motor patterns or movement in the individual, especially in athletes. So it's important we take these steps and these fundamentals as we're breaking down each individual athlete's problem and moving towards the solution to get them better. So again, the tissue must be cleared out to create the central nervous system to adapt properly to create the proper movement. So how do we go about doing this? We take some steps approach. First, we need to know load versus capacity. So the first part is load. This is basically what the stress is the athlete putting on their body on a regular basis. In most cases, it's the physical sport and practice themselves. There could be some emotional stresses that are on the body, and there could be some nutritional stresses, which Kate will talk about later. But again, all these need to be addressed appropriately. In my case, we're going to talk more of the musculoskeletal load that they're putting on their body through whatever sport that they're playing. The capacity is what tissue needs to be healthy in a specific area to carry out in full function and performance. So all the tissues in the body have a breaking point or a point where they start to compensate. So keeping capacity overload equals health, and the body is functioning as close to 100% as possible. The athlete is competing at its highest level. When load exceeds capacity, dysfunction occurs. When we have dysfunction, usually it's a repetitive stress over time, and these excessive loads create a layering tissue effect until symptom threshold is reached. There's usually some type of pain or tightness or numbness when an athlete usually comes and talks to the trainer or trying to get some type of treatment. It's usually been going on for a while. So as this layers on top of each other over years, there's different tissues dysfunction, and then you reach your symptom threshold. It's important to note that in some cases, some athletes will just take some pain medications or do some other things that raise the symptom threshold up to this point, and the tissue dysfunction is still underneath it, but the symptoms are disappeared. And it's important to not only get them out of pain, but also create the dysfunction so you're not just managing symptoms because it's a false sense of security. And then they keep doing their activity, which raises more dysfunction and can butt up against the symptom threshold that calls for their injury. So what we're trying to accomplish is removing the actual tissue dysfunction. So not only they're getting out of pain or the discomfort they're feeling, but they're functioning as close to 100% as possible, and we're increasing the capacity while lowering the load of those layers. So when we're looking at the different tissue types, the main dysfunctions that we see in all different tissues are, so the muscles, you'd have adhesion, the joint used to have misalignments and degeneration, the ligaments, you'd have adhesions and degeneration, the tendons, you have tendinosis or tendinopathies that occur, cartilage, you have degeneration, nerves can be entrapped, discs, you got to have internal disc derangements or herniations, and bone stress fractures or other fractures. I forgot to include head and neck injuries like concussions or whiplash injuries that can occur as well. So as you break down the low capacity and build through those mechanisms and identify the type of dysfunction in the tissue and learn how to treat it properly, usually most athletes get the results that they need and they compete at the highest level. So one of the most common things I see, especially in athletes in the soft tissues, is the adhesion itself. This is one of the most common things that you'll see in athletes and their injuries. And here's the mechanism of how it occurs. So you have some type of acute injury, a repetitive motion such as their sport overuse injury, or sustained pressure or tension. So sitting in class long periods of time, working on the computer, studying, looking down at a textbook, all those things can cause adhesion, and then you get decrease in oxygen and blood supply and you get through the cycle. Without taking care of the adhesion properly, they will continue to move through this cycle and not get the relief that they're looking for. So in saying all this, we'll move through a case study. This one specifically is for a shoulder. And taking all these principles and moving through, we had a lot of questions on different, oh, they can't see the slides.
Okay, we're going to pause for a second because we were told you can't see the slides, and that would be quite useful to you. So we're going to get those loaded the correct way. Ah, look, here they are. So Dr. Paul, if there's anything you would like to go back and just quickly review since we can actually see the slides now, that would be fantastic.
Okay, sorry about that. I was just talking up a storm. Okay, so what I was talking about was Janda, and what I was referring to. So tissue dysfunction needs to be corrected because of causes central nervous system adaptations, which cause poor motor patterns in the athlete, which can cause injury and pain and decrease sports performance. So we're looking at, this is our sweet spot of correcting the tissue first and then moving into the necessary areas to fine tune the central break to the central nervous system and the motor patterns. So we talked about lowest capacity. Again, tissue dysfunction layering on top of each other real quickly into the symptom threshold, and then going into the joint dysfunction and into the adhesion model as they're breaking through this adhesion model and this cycle that can occur if the adhesion is not taking place accordingly. We're good? Okay. So taking all those principles of low capacity, dysfunction in the tissue, what type of tissue is dysfunction, we'll move into a kind of a case study and the approach that I take going into all this. So in this case, it was a shoulder injury. Each individual case in an athlete obviously requires a different look and different protocol of what you're doing. But in this case, the case study was on a 20-year-old heptathlon athlete and former gymnast with right shoulder pain starting in May of 2012 after throwing javelin. After 5 to 6 months of rest, no improvement in symptoms occurred. The MRI and arthrogram and x-rays were negative, so there was no signs of severe degeneration, any types of tears or excessive strains or sprains in the area. Pain meds, steroid injection, no improvement. Did different types of kinesio taping or multiple different types of taping, little to no improvement. And then multiple types of rehab for 4 weeks or longer and no improvement. When you're looking at the shoulder, in this case, We'll talk a little bit more specifically. In almost every shoulder dysfunction, unhealthy tissue causes the restriction in the glenohumeral joint 99% of the time, unless there's some type of tear in the AC joint or excessive degeneration or labral tear. The two most functional anatomy movements of the shoulder are the shoulder abduction and horizontal abduction. In this case, you see the horizontal abduction of this athlete. This is the first initial photo when she first came in. This is what her shoulders look like. If you have an athlete with shoulder pain and you have them do the shoulder abduction, just have them stand and face the other way and raise their shoulders over your head. Raise the shoulders overhead. And it looks like this, where it's not even. This is what you want to have. This is after a few weeks of care, where everything's nice and even. They're able to bring it up overhead, and I'll show them some other photos. This is showing that if they cannot do this and look like this without any other types of tears and other degeneration in the shoulder, that they're going to have a problem. So this is moving through a few treatments as we moved along through the care, and this is considered normal. So what we need to do is I had to find what tissues weren't lengthening on the glenohumeral joint that was causing the restriction. As we move through, here's her horizontal abduction movement. Here's relatively normal. This was more of her provocative test here to just kind of see that felt normal to her. As you can see, the right arm is slightly forced outward and rotated. And here it is where it felt normal. She was never able to do this until we worked on her, so we were testing it out. And then it also a common compensation that you'll see is the forward flexion of the shoulders in this position here when you look to the side. And this is what it should look like in most individuals. So the forward flexion occurs is because when they move the shoulders in the shoulder abduction and raise them overhead, they can't stabilize, the rotator cuffs can't stabilize the humerus in the socket, and so it restricts in the serratus anterior, blocks that motion and shuts it down. And so what they do to compensate is they'll move their shoulders anteriorly, like in this position, and have this forward flexion in order to get them over the head. When it's moving correctly and can stabilize in that area and lock in position properly. Okay. You see how they're from the side, the picture from the side, and they're overhead. How it's supposed to look. So we have some videos that didn't quite load, but we'll move on. So patient outcomes, when general cases, you remove the dysfunction in the peripheral tissue and restore range of motion. In most cases, this takes care of the problem. In some cases with athletes, depending on how long the problem's been there, you need to increase focal strength. So different activities of daily living, athlete-specific sport, or some type of PT or rehab, especially if it's a tendinopathy. You usually have to do some type of strengthening training once the tissue is healthy enough. Athlete sport, so for this individual, because javelin was what caused the pain, we were having her throw javelin and move up slowly through that, and then following up with her and seeing how that feels, and we're creating any different layers that we may find in that area. You also can increase overall strength, so specific sport-specific conditioning helps once the tissue's healthy and they're stabilizing, especially in the off-season can help. When the dysfunction is reduced and stable, you usually discharge the patient. There's sometimes mild and unstable irreducible blocks, such as disc herniation or moderate severe degeneration. You go on a maintenance schedule. Most athletes, when they're in season, do see me on a more of a maintenance basis because of what they're doing with their body. Going through all the practices and meets, they're putting their body through a huge load on a consistent basis. So they usually like to have a maintenance program going on to make sure they're functioning as possible. And then severe unstable irreducible blocks, nutritional deficiencies, to refer out to make sure those are taken care of. So any tears that need a surgical consult, or maybe some thyroid disorder that needs to be looked at, you need to make sure you refer to the appropriate person that's maybe causing some of the musculoskeletal pain that's occurring. So when to refer? Most providers, other trainers in the area, refer to me when there's reflexive or no change in the symptoms or range of motion after 3 to 4 weeks of treatment and quality rest. So what their main things that they usually do that get results aren't working, or it's kind of a symptom improvement for a day or two and then it stops and doesn't get any better. The athlete who seems to get injured with increasing loads, so usually when peak training season starts and after weeks and months of rest, you see them injured again, or they're in your facility getting treatment quite a bit with little to no improvement. Or you have athletes that are getting multiple flare-ups of the same injury in the season that cause athletes to miss games and practices, such as tight hamstrings, calves, lower back injuries, plantar fasciitis, and tendinopathies. These are all cases that usually, in my case, I can work with, is making sure the tissue is healthy enough and you can get these, or other healthcare providers can help you work with these to get these fixed for you. So this is usually the general concept of when I refer out to people. It usually works pretty well for the athletes in getting this set up. So now I'm going to introduce Kate Davis. She's a registered dietitian and board certified specialist in sports nutrition. She's the owner of RDKate Sports Nutrition based out of Naperville, Illinois, where she helps individual athletes of all ages, levels, as well as athletic teams, clubs, and organizations to understand what to eat, and when to supplement. Kate has been quoted in media outlets such as Runner's World, Competitive Runner, and Chicago Athlete magazines. She has previously worked as a sports dietitian at IMG Training Academy with Division I athletes at Michigan State University and as an adjunct professor at Robert Morris University. Kate loves competing in road running and running races, triathlons, indoor soccer, and also enjoys snowboarding, rock climbing, and an all-around great person. Welcome, Kate.
All right. Thank you very much, Dr. Paul. I would like to first start by saying that everything that I'm saying today, I want to emphasize that my recommendations should not take the place of a doctor or athletic trainer's directions. Instead, they can be used as helpful additions to an existing rehab or medication plan. So as athletes grow and progress in their sport, both intensity and time spent in training increase. This can leave the body short on nutrients that provide protection against illness or injury. It's not uncommon for athletes to suddenly become sick or suffer an injury after a change in their workout schedule, or when transitioning from middle school to high school or from high school to collegiate athletics. So to protect themselves, athletes should change their eating along with their training. So the main key is to eat a diet that's rich in whole grains, fruits, vegetables, lean protein, and healthy fat, as these provide vitamins, minerals, and antioxidants. So the goal is really less packaged food and more whole foods. And that is what this athlete's plate portrays. This visual is actually developed by the dietitians who work with our Olympians. So good timing there. One area of focus in this plate should be the fruits and vegetables, as you can see. These are full of vitamins and minerals. Antioxidants, which are a specific group of vitamins, help to recover exercise muscles as well as prevent excessive soreness. And proper recovery is what prevents illness and injury. Another area of focus with injury prevention in an area of the plate is fat, particularly omega-3 fatty acids. In athletes, omega-3s help decrease inflammation in the body, which is caused by intense aerobic activity or by lifting. So excessive inflammation can lead to illness or injury long term. So instead of an omega-3 supplement, you really want to encourage athletes to increase their intake of foods that are high in omega-3s. The goal is 1 gram a day. And looking at the table here, you can see it's really not that difficult if they choose foods wisely. So 28 grams of chia seeds, you're already getting almost 5 grams of omega-3 just from that. 1 tablespoon of whole flax seeds is 2.5. If you can get ground flax seeds, that's something you can add. Ground flax meal is something you can add to anything. You can put it in soups. You can put it in spaghetti sauce, baked goods. So it's really easy, actually, to get a lot of omega-3 from your diet. However, for athletes who either can't or do not eat enough food sources of omega-3, a supplement of about 1 gram a day does appear helpful to decrease inflammation before injury occurs. And we'll talk more later about recommended brands because that does make a difference. Another thing that athletes should do is increase overall caloric intake to assure they are providing their muscles with enough fuel to recover. Sometimes athletes don't realize how much they need to eat and they inadvertently put themselves at risk for an injury. So education on caloric needs for energy expenditure is really important here. Increased levels of vitamin D are correlated with numerous musculoskeletal and immune system benefits, including reductions in the reported incidences of colds and flu. The incidence of vitamin D deficiency in elite indoor athletes is as high as 94% of basketball players and 83% of gymnasts. There is actually a recent report included testing of the New York Giants during spring practice, and this showed that 81% of them were vitamin D deficient. So this is athletes that were actually outside, and they were still, the majority of them were deficient. If an athlete is vitamin D deficient, they will need a supplementation, and a supplementation is necessary when their blood levels are less than 30. Many athletes do not realize or take seriously the impact that drinking has on their body and their training. Heavy drinking in one evening can cause athletes to lose up to 14 days of training results. So I've listed a lot of the things here that can happen as a result of drinking. There's a higher injury rate in drinkers, and of course this is huge when we're talking about athletes and keeping them playing and keeping them competing. Alcohol use also hampers ability to learn new information as well as memory and retention. So if an athlete drinks after a day of classes, then studying, learning new plays, none of that is going to be as effective anymore. Alcohol also decreases human growth hormone by about 70%, which impairs muscle repair. It decreases the ability of proteins to repair your muscle fibers after a workout, so therefore it's going to affect your body's ability to heal. It also increases the release of cortisol, which is a stress hormone. So cortisol will decrease your training outcomes if it remains high for too long. Because alcohol makes you urinate more, then clearly it's going to dehydrate you, but you also will decrease the amount of vitamins in your body that hormones do depend on to help you recover. Alcohol disturbs your sleep, and when athletes are sleeping is when the majority of their healing and recovery is going on. Clearly it increases body fat. The body treats alcohol as a fat, so it converts alcohol sugars directly into fatty acids. It can't convert alcohol into glycogen, which is the body's stored energy source. So just because there's carbohydrate in beer, it's not helpful because it's converted directly to fat. Alcohol use also inhibits the absorption of vitamin B12, thiamine, and folic acid, as well as zinc. And all of these, what we call micronutrients, play a role in muscle recovery, muscle repair, and injury prevention. So that's the prevention side of things. Those are kind of the main things that athletes really need to keep in mind, kind of the big things. Well, what happens after an injury occurs? So when athletes think of nutrition, they don't automatically think sometimes how nutritional habits can positively affect their body's ability to recover from an injury. But athletes need to know that in addition to an aggressive rehab plan, they have another tool in their back pocket, which is a well-constructed nutritional intake program that can help speed recovery. So the right intake can put the athlete on the road to a speedy recovery while lessening the risk of a repeated injury. So when talking about how nutrition aids the recovery process, injuries can be separated into four major categories. Number one is injuries that require surgery, and nutrition has obviously the biggest impact on the most serious injuries. Underfueling during the immediate recovery process can delay repair, so this is not the time to put an athlete on a diet. Immobilizing injuries are when an athlete is immobile and they must change the way that they obtain, prepare, and sometimes even consume foods. They will need to identify quick or already prepared options that provide quality nutrients without unwanted fat, sugar, and sodium. So consuming a high-quality diet while immobile should shorten the time that the athlete will remain immobile, allowing them to start the rehab program sooner. The third type is fractures, and because bone fractures in the lower body often require weeks, if not months, of being in a cast or using crutches and/or a walking boot, athletes' energy and nutrient needs will actually remain elevated for a longer period of time. So due to the length of recovery time required for these injuries, athletes are likely to experience more muscle loss and also body composition changes. In addition, if an athlete broke a bone due to poor nutrition, then clearly they need to be evaluated by a physician or a registered dietitian. The last type is strains and pulls, and this would include any recurring or nagging aches and pains that you might have. I know when a lot of you registered, that's the type of injury that you noted. Because these injuries are less severe, damaged muscles may not require the same caloric intake as the injury previously mentioned. However, recovery can still be positively impacted with improved nutrition, especially intakes prior to, during, and for the first several hours after training and treatment sessions. So when I'm talking to an athlete, it's a good idea to keep in mind the different stages of injury that occur. The first stage is what I call the time for initiation of the immobility. So this is great if we know in advance that an athlete is going to be immobile, if it's an expected surgery that's coming up, because then we can really plan for that. But whether we know or not, the second stage is the immobilization or the atrophy stage. So this can last from a few days up to several months. It might be a partial or a full immobility of the injured limb. And during this time, metabolic changes in the tissue from disuse lead to loss of strength and function. So there's a lot of inflammation during this time. There's a lot of natural loss of muscle mass, but the bones, the tendons, ligaments, all of these are affected negatively during the immobilization related to a decrease in collagen synthesis. And of course, the third stage is the return of mobility. Rehabilitation and increased movement leads to the recovery of this muscle loss and a return of functionality. And it's very clear that the complete recovery of strength and function takes a lot longer than the time it takes to lose all of those. So what is some of the testing that I would recommend that you do with athletes who are injured, whether we're talking about the minor aches and pains or maybe an actual injury that requires surgery? But there's a lot of lab testing you can do, and really it comes down to the individual athlete, what's really going on with them. So I can't even give recommendations without talking to individual athletes. However, some of the big ones from this list I would say are, vitamin D. There's a lot of research on vitamin D, but also checking out iron levels. That's a big one too. So hemoglobin and ferritin specifically are going to be two. Some other testing that you might want to look into is a resting metabolic rate. This is a great way to educate yourself as well as the athlete on what's actually going on with their metabolism in the immediate post-injury time or kind of down the road, how that metabolism changes. Body composition testing is another one. So getting a baseline of their body comp right after the injury occurs so that you kind of know where the athlete was before any changes happened. And then checking that, maybe every 4 to 6 weeks to kind of see what's going on with the body at that time. So immediately following injury, the body requires an increased caloric intake. And we're talking about those injuries that are the really serious ones. So these aren't these minor aches and pains and strains and pulls that you might have. But after a major injury occurs, your body does actually have that increased caloric intake because the body is utilizing more calories to aid in healing. Resting metabolic rate during this time can actually raise anywhere between 15 and 50%, depending on the severity of the injury, and 15 to 20% following surgery. So this means that an injured athlete might need an upwards of 500 additional calories a day during the healing process. After the initial surgery or injury period, the concern then becomes dealing with this decrease in activity or maybe other unexpected issues such as nausea or other side effects of medications. Energy needs still do vary widely, though. So, for example, ambulating via crutch requires more energy than walking. So maybe the athlete isn't running drills or lifting weights, but hauling themselves up a flight of stairs and getting around on crutches is hard work, and that burns plenty of calories. So the supposed decrease in energy expenditure really does depend on the level of activity of the athlete and may not be as low as some assume. Undereating during this time can actually prolong inflammatory response and slow down immune function. So this is an especially important point for female athletes who tend to worry about their weight more than males. A 3 to 5 pound fluctuation in weight in either direction isn't cause for concern during this time, but more than that obviously should be addressed. Now it's been demonstrated that undereating by 20% for 10 days reduced muscle protein synthesis by 19%. So decreased synthesis is a major contributor to muscle loss. So sometimes, perhaps even a small weight gain might be preferable to not giving the body enough energy and having this lack of support for proper muscle healing. Now, of course, there is the time that it's an athlete that happens to be immobilized long term. Maybe there's a true concern for weight gain. Well, clearly then diet modifications must be made. However, in doing this, the athlete should never feel extremely hungry, should never be lightheaded or weak or be losing weight. These are signs that he or she is not eating enough. So here's some guidelines here. Number one, don't skip meals. They may need to be smaller, but don't skip them. Eat fewer carbs, but don't omit them. As exercise increases, carbohydrate is the body's main source of fuel. So if you're doing less, you clearly need less, but that doesn't mean you should cut them out altogether. Keep treat foods to a minimum, but again, don't avoid them entirely. Anything that an athlete is told not to have, that's all they will want, and it creates a bad relationship with food. So just keep them to a minimum. Don't skip on protein, and we'll talk more about this in future slides. And finally, it's very common for hearing friends and family to bring cookies or treats for injured athletes, but instead maybe ask friends and family to bring you healthy snacks, so veggie trays, fruit trays, portioned out trail mixes, appropriate granola bars, or individually portioned healthy meals, things that are going to help you heal. Inflammation is a natural byproduct of all injuries. So inflammation is not necessarily a bad thing. It's simply part of the body's response to injury. But it is something that should be kept under control to decrease recovery time. Foods have the ability to affect inflammation in both positive and negative ways. So what we're going to do is talk about some of the specific macro and micronutrients that may aid in the management of inflammation. Remember, it really is best to obtain all of your nutrients from whole foods whenever possible. So first, let's talk about macronutrients. Again, the main key is really just to eat a diet that's rich in whole grains, fruits, vegetables, lean protein, and healthy fats. So that same plate that I showed you for prevention, that can really hold true and carry over to treatment time as well. The first category is carbohydrates. As I kind of briefly mentioned, carbohydrates clearly will need to decrease. The athlete's not as active, they're not moving around as much, you don't need as much carbohydrate. Get most carbs from whole grains, so we're talking about oatmeal, popcorn, whole wheat breads, whole wheat pasta, whole wheat crackers, whole grain cereals, and also fruits and veggies. And try to focus starch intake around any lifting or any intense rehab sessions. That's really when your body needs that carbohydrate. Choose smaller portions of white pastas, potatoes, bagels, pancakes, desserts, anything like that until you're training hard again, and then you can get a little larger with those portions. In terms of protein is the key for tissue repair and remodeling. So rehabbing an injury often requires upwards of 2 grams per kilogram of body weight of protein. So if we're talking about, for example, a 60 kilogram athlete, which is around 130 pounds or so, if you need 2 grams per kilogram of body weight, you're talking about 120 grams of protein. But you really only want about 30 grams per meal or snack. And 30 grams is equivalent to about a deck of cards size of certain meats. It's generally pretty close to that. So it's not really a lot of protein in one sitting. And what I see is that athletes get very overportioned with their protein intake at meals. So let's go back to talk about fats again. We talked about it during the prevention time. Dietary fats, depending on the form, have the ability to reduce or promote inflammation. So foods that contain trans fats and saturated fats tend to promote inflammation, so you really do want to avoid those foods. Limit intake of vegetable oils, so corn, safflower, sunflower, soybean, all of these oils. Limit intake of red meat, bacon, while altogether skipping foods that have trans fats. So a lot of the processed cookies, processed crackers, chips, and fried foods. High-fat meals really crowd out room for the nutrients required for recovery. Also, if eaten in excess, then clearly this can lead to training one problem for another. First, you have an injury. Well, now you're developing things such as hypertension, cardiovascular disease, inflammation, or maybe you're just putting on excess weight that you didn't want. Conversely, foods that contain omega-3 fats may decrease inflammation. So again, just like with prevention, the same holds true in treatment. In fact, a systematic review of 23 randomized controlled trials found that EPA and DHA, which are types of omega-3s, improved several symptoms of swelling and pain and decreased use of anti-inflammatory drugs. Omega-3 fatty acids, and more specifically DHA, have also been shown to improve the plasticity and recovery of neurons and reduce oxidative stress and damage from traumatic brain injuries. So, when we're talking about concussions, which is kind of a hot topic right now, DHA, a type of omega-3, that's what your brain is made of. So there's pretty good evidence that omega-3s may be protective for prevention of brain injury and recovery after a brain injury. So again, in these cases of concussions. Some food examples are listed here. Again, a lot of the ones you saw before. You want to use extra virgin olive oil when possible. The purest is better. If the athlete is not getting it from food, to be honest, we don't have a lot of hard scientific data on dosing a supplement. We don't really know what that supplement number should be, but it seems to be that for prevention of injury, as I mentioned, it's about 1 gram a day, but for treatment after injury, you might want to do up to 3 grams a day. And here, quality matters. Okay, so the best quality source is going to be triglyceride-based omegas. Nordic Naturals is a great brand. It's the most highly purified and the best out there, but you're also going to spend more. You know, when you go and just find whatever random omega-3 supplement on the shelf, I want you to think of the sewer of the sea. That's probably what it is. The less you pay, the worse it is. You've got to dole out the big bucks here to get the good stuff. So Nordic Naturals is great. Carlson and Kirkland are also good brands. Hydration. It's an important part of healing and rehab. Since athletes are not sweating nearly as much due to less activity, athletes often feel less thirsty and less triggered to drink. The body fluids are needed to deliver nutrients to tissues all over the body and to support soft tissues and joints. So remember, your body is over 60% water. Athletes need to drink water all day with special attention to hydrating well before and after exercise. So let's move on to talk about micronutrients. So we're talking about vitamins and minerals here. Although nutrients in pill form cannot replace the strength of whole foods in the recovery process, they do provide a little backup, a little insurance that an injured body is getting the micronutrients it needs. So you really want to choose a multivitamin that includes no more than 100% of each daily nutrient. And this is important. You want to check that label, make sure that's the most that it has. Look for a well-known brand or one that has one of the certifications listed. So United States Pharmacopoeia or USP, Informed Choice, or NSF Sport endorsement, because this is going to limit the possibility of consuming a banned substance. But remember, you can't get everything in a pill. For example, colorful fruits have healing properties such as antioxidants, phytochemicals, flavonoids. Their vitamins and minerals are also better absorbed than pill form if you get vitamins and minerals through food. Now, a deficiency in almost any vitamin and mineral can impact healing, but today I'm going to highlight what I would say are some of the most important ones for injury rehab. Keeping in mind that the bone, the tendons, the ligaments, they're all impacted negatively by immobilization. Collagen is the primary component of tendons and ligaments as well as bone. So both of these vitamins here assist to rebuild collagen. Vitamin C specifically helps the body fight inflammation and form collagen. You want about 2 to 3 sources daily from the foods listed. Generally, if you're getting in your fruits and vegetables, you're probably hitting your vitamin C levels just fine. Vitamin A reduces early inflammation after injury. It helps to reverse post-injury immune system suppression, and it assists in collagen formation, as well as cell growth, recovery, bone growth, support of immune function. So it's a pretty important vitamin. Again, we're looking at about 2 servings a day. You can find this in a lot of foods, dairy products, veggies, the darker the better, butternut squash, some fruits too. Looking at those darker sources of fruits and vegetables, you're going to be hitting this too. Zinc is required for the functioning of over 300 enzymes in the body, and it plays a role in DNA synthesis, cell division, and protein synthesis. So these enzymes are really necessary for wound healing, including tissue regeneration and repair. You want to look to be getting about 2 to 3 servings a day from foods that are high in zinc. So talking about animal meats, oysters, clams, fortified whole grains, especially breakfast cereal. Athletes love breakfast cereal. So really, trying to get them to get those fortified cereals in. Almonds, sunflower seeds, yogurt, beans, and hummus. Calcium coupled with vitamin D to protect bone density. You want about 4 to 5 servings a day. Honestly, the easiest way to get calcium tends to be those dairy sources because they are the highest. It doesn't mean that you have to get it from dairy, but that tends to be the easiest. But there are now a lot of calcium fortified products out there, talking about juices, breads, again, cereals, where you can get calcium as well. Vitamin D. There's been a lot of recent studies that have shown that vitamin D increased the effectiveness of the immune system, with increased vitamin D levels decreasing inflammation. So it plays a huge role when we're talking about recovery. Vitamin D is difficult because it's not found in large quantities in a lot of foods. But again, that goes back to the idea of checking your vitamin D level, having your athletes check their vitamin D level and see if they are in fact deficient. If they are, then a supplement's necessary. If they're not, then it may or may not be necessary. It just depends on the athlete. But you can see a couple of options for where you find it in foods. So when we're talking about spices, there's some very interesting research on different spices and how they can decrease inflammation in your body. These are going to be the top three. So particularly using spices like curry powder, ginger, and garlic. And, to simplify with my athletes, I just tell them, just spice your foods when you're cooking. Just spice freely. Add these spices whenever you can. Because, again, it's just a little bit more that you can do for yourself. And how easy is it to spice your food? That takes absolutely zero effort. So it's an easy thing to say to your athletes, hey, just add curry powder, ginger, garlic, whenever you can to what you're cooking, because there is some great research that shows that these decrease inflammation, decrease muscle injury pain as well. So here's a sample meal plan. So let's say we're going to put this all together. How might this look for an athlete? And obviously this varies based on what the athlete's needs are, their calorie needs. But as an example, for breakfast, they might have 2 slices of whole wheat toast, 2 eggs, and an orange. For lunch, they might have 2 slices of whole wheat bread with turkey and cheese, some cherry juice, some almonds as well. An afternoon snack, or perhaps that snack before practice, might be Greek yogurt and a half a cup of raspberries. Dinner might be a cup of pasta, preferably whole wheat pasta with marinara. A chicken breast, spinach salad with sunflower seeds and oil-based dressing, and then, of course, another evening snack to help them recover overnight, cottage cheese and pineapple. So what you see here is a lot of whole grains, a lot of color, so thinking of color in their plate, and also a good dose of healthy fat. So I'm going to end with talking about stress fractures specifically. This is something that I see a lot in my office, or else it tends to come up as I'm talking to athletes, because a lot of athletes don't realize that stress fractures have anything to do with nutrition or poor nutrition in general. When we're talking about stress fractures, if you have athletes that have a history of them or are maybe struggling with them or have had them at any point in time, the first really important thing with ladies is talking to them about maintaining a regular menstrual cycle. Now, obviously, if the ladies are taking birth control, this really doesn't apply. You have to get them to stop temporarily, or you just can't use this as an indicator since birth control throws this off. But athletes have a 3-time greater risk of injury if they are not having a regular menstrual cycle. We're talking about every month having that regular period month to month. They have a 3 times greater risk of injury compared with athletes who do have a regular period. Bone mineral density declines as the number of missed periods accumulates, and this loss may not be fully reversible. So the prevalence of not having a period has been reported to be as high as 69% in dancers and 65% in long-distance runners, compared to 2 to 5% in the general population. So that's why a lot of times you'll hear from particular doctors who will say, well, you're not having your period, well, you're just an athlete and that's what happens. But it does have a lot of issues, long-term issues for the athletes. Inadequate body fat stores and exercise stress have been proposed as the reason why menstrual cycles are disrupted, but research into these hypotheses has shown that body composition and exercise stress play absolutely no role in the disruption of menstrual cycle in athletes. So it really does go back to eating enough calories. Really encouraging athletes to eat and to accommodate their increased energy expenditure. Athletes can lose their period without restricting their diets on purpose, because they might simply fail to increase their dietary intake to cover for exercise energy expenditure. So again, even an acute decrease in caloric intake can have a big impact. Now, much research has been conducted on the association between vitamin D blood levels and the incidence of stress fracture, particularly in military recruits. At this point, research is a little bit mixed whether there is absolutely a direct association, but supplementation of calcium and vitamin D as a preventative measure for female athletes who are involved in rigorous training does seem to be reasonable based on current data. And again, checking that vitamin D level, and for stress fractures or a history of stress fractures, I like to see that level at 40 or higher just to keep them protected. And obviously with stress fractures and particularly, that's a good situation where they need to be seen by a dietitian for nutritional counseling. So when do you prefer, or when do you refer, when do you send your athlete out to a dietitian? When general information is not enough. If you're an athlete listening today and you want some more individualized advice, if you're a trainer or a coach and you're getting questions that are more individualized and you can't answer those questions because you don't know, before an injury occurs, if you're seeing any signs of underfueling either in yourself or in your athletes or in your patients, that's a great time to send them to a dietitian. Immediately upon injury, the sooner they can get in, the better, because the less damage is done at that point. Or any time post-injury is really a good time. So in closing, here's my contact information, and I just want to say, a great recovery diet will set the athlete up to prevent another injury. So what they say about sports proves true for nutrition as well. The best defense is really good offense. Here's my list of references. If you do want these, please just email me and I'll send you a more readable list that you can use and refer to. And at this time, we have some time at the end. If you do have any questions, just as a reminder, you can type them into the chat box on the bottom left side of your screen. And while we're waiting, I just want to thank everyone for attending today, and we will send out the recording, the link, so you can feel free to share this with your coaches, with other health professionals in the athletic arena, or just anybody that you think might be interested in this presentation. We'd love for you to share it. Okay, any questions?
Any questions?
All right, well, thank you so much for attending today. Thanks for your attention. And if you do have any individual questions or would like to follow up, please feel free to contact either myself or Dr. Paul.
Thank you all for attending.
Thanks. Bye.